Let's look at the two different strategies for health care reform in the House and the Senate, what we know of the Senate so far. Here's Chief Congressional Correspondent Mike Emanuel.
Trying to find consensus on repealing and replacing Obamacare, Senate Republicans are discussing options, hoping to vote on a plan before the 4th of July recess. Republican sources say the ideas include extending the Medicaid expansion and taking steps to help the fragile individual insurance markets. But Senate Majority Leader Mitch McConnell is not giving up details.
I'm not going to go into the various component parts of the health bill. We believe we can do better than the status quo.
The path for McConnell to pass a health care bill isn't easy with just 52 Republican senators. If he's counting on GOP votes alone, he can only afford to lose 2 and then have Vice President Pence break the tie. Other top Republicans say they must act this summer.
In Iowa, we learned that there are no insurance companies that are willing to sell health insurance on the individual market. That isn't because of anything that President Trump or the Republican majority has done. These are the failures of Obamacare.
Last month's vote in the House was tight, 217 to 213. The Congressional Budget Office predicted the House bill would cause 23 million Americans to lose insurance over the next decade. It would cut nearly $900 billion from Medicaid and eliminate its expansion under Obamacare in 2020, leading most Senate Republicans to declare the bill dead on arrival. Senate Democrats are urging their GOP colleagues to work with them.
If the Republicans will set aside this partisan, gun-at-your-head kind of approach, we stand ready.
Other Democrats are warning of dire consequences if entitlements are touched.
It's going to result in grandma and grandpa in nursing homes with Alzheimer's not getting the coverage for their nursing home beds.
3 moderate Democrat senators to watch are West Virginia's Joe Manchin, Missouri's Claire McCaskill, and Montana's John Tester. All 3 are up for re-election next year. Democratic sources say they only expect GOP outreach if they find they cannot pass a bill on their own. One potential challenge is Kentucky Senator Rand Paul, who has argued for finding a way to fully repeal Obamacare and not just fix it. And some suggest he's a no on what's being discussed. Texas Senator Ted Cruz has participated in the health care talks, but some are concerned he could back away in the end.
A short time ago, Senate Budget Chairman Mike Enzi announced that the House health care bill fits the rules for a special process known as reconciliation in the Senate. That means health care reform can be passed with a simple majority and no filibuster. Brett?
Mike Emanuel live on the Hill. Mike, thanks.